And now it's time for the sponsor perspective portion of our program. Before we get underway, a quick clarification. While this interview is being conducted totally by me and these questions are mine, which my friends may regret, this content should not be considered editorial. With that, I'm joined by Dr. David Skorton, President and CEO of the Association of American Medical Colleges, and Karen Fisher, AAMC's Chief Policy Officer. Really great to be with you both. I hope you enjoyed David, we were talking about you. I hope your ears weren't burning a little bit, but let me start, basically open up the conversation about this COVID era time and AAMC, your Association of Medical Colleges' role in essentially saving the nation. David?
Well, first of all, it's a pleasure to be with you. It's great to work with you always, Steve. And I'm so glad that you have our wonderful Chief Public Policy Officer, Karen Fisher. Please, Steve, if you do me a favor, for all the years we've known each other, give me the easy questions and give her the really tough ones, if you would. So I'll share a little tiny bit for those who may not be familiar with the details of the AAMC. So we're an organization about 140 years old, which we have as our members all of the accredited medical schools in the United States and in Canada, about 400 teaching hospitals, that is academic health centers, teaching hospitals, and health systems, and about 70 academic societies. So as far as I know, we're the only national organization that brings together the hospital leaders, the medical school leaders, the educators, the researchers, all together to do what needs to be done. And we do all have to pull together to move ahead in this very, very persistent and terrible crisis that we're in right now. So our idea is to pull in the strength of our membership, the strength of our brain trust, like Karen Fisher, and try to find a way forward, working closely and collaboratively with our colleagues in government.
Karen, thank you, David. Karen, one of the things that I think our role and responsibility in these discussions is to help our audiences, help those people coming back to view this, to separate signal from the noise, to understand what issues are vital to understand and what's the pathway forward versus a lot of clutter and noise out there. You have issued, at the end of July, AAMC roadmap, the way forward on COVID-19. Can you give us the essential nuggets that our audience needs to understand?
Well, I can start, and I'd like David to jump in. As David mentioned, it is a roadmap, and it's talking about some of the issues that you talked about with Congresswoman Matsui, Steve, and that includes the issues around supplies, personal protective equipment, the issue of adequate and rapid testing, the issue surrounding vaccines. And then we also talk about the role of public health and the importance of having a strong public health infrastructure. We also talk about the importance of masks and the wearing of masks and social distancing during this front. And then we also talk about health insurance coverage, which you talked about with the Congresswoman, and the importance of having coverage not only during normal times or regular times, but importantly during pandemics, when we are having people who are becoming employed through no fault of their own and losing their health insurance as a result of that. We need to find a way to protect those individuals during that period. So that's some of the items in the roadmap. And I don't know, David, if you would add some others that were in there.
Well, really, Steve, Karen hit almost all the big ones and did it very eloquently. The only thing I would add, which we're learning, unfortunately, a lot about during the pandemic, is the fact that we have to address and solve problems with healthcare inequities and health inequities in our country. Now, the pandemic didn't create these inequities, of course, but they brought them out really, Steve, in bold relief. And as we know, communities of color, our African Americans, and Hispanics, and also Native Americans and Alaska Natives, they're suffering much, much worse, as well as those who are incarcerated, those who are homeless, all of these areas that reflect the terrible health inequities that have really gone on for generations and generations are making their fate much worse in the pandemic. And we need to focus on that. And that's one of the other elements of the roadmap.
Well, let's grab that for a minute, David. Recently, I interviewed Dr. Robert Redfield, the director of the CDC, and he said something very stark. He said, Steve, we're going to have to look at the infected person, the suffering person who may be homeless, without resources, without people to turn to. We're going to have to give that person support. We're going to have to give that person housing. We're going to have to surround them with support. We need to begin at that point and work back and ask ourselves how we get there. I thought it was a really interesting mental and policy experiment to begin asking us, how do we get there? Because to me, it seems we're far away from that. Have you thought at all, about that challenge? Not just about that individual and homeless, but when we talk about creating greater, fairness and equity, shared equity in our health programs, it's one thing to say it, it's another to do it. So, what are some of your thoughts, David?
Well, really, Karen mentioned the very, very important aspects of how we need to think about health insurance coverage. And really, we need to have access and coverage for all people living in America. This virus doesn't respect your documentation status. It doesn't respect whether you are living in a certain zip code or another zip code. And so we have to take that attitudinal change where all living in America need to have coverage and access to health care. Now, I'm not saying what the approach should be. Obviously, there'll be a lot of talk this week and next week at the conventions about how that might be approached. But the main point is the intentionality of deciding that everyone living in America needs to have health coverage. And this could be, as our listeners will know, and Karen would know better than I, it could be a public option. It could be some other approach. And right now, where a largely employer-based healthcare insurance system is being really strained by the large unemployment numbers, we have to think about whether we might ask Congress to perhaps partly subsidize COBRA coverage, a mechanism that's already in place to make sure that there is broad coverage. But whether we're talking about people who are working, people who aren't working, homeless, incarcerated, whatever it is, we need to have health care available and accessible to all living in America. That's the answer.
Karen, you basically operate in trying, and I'm going to put words in your role, to create literacy and understanding in the policy community here, particularly in Washington, about what's going on in medical colleges, what's going on, with frontline providers, what's going on with training, what the impact, what's going on in research and the partnerships involved in addressing COVID. What do we all need to know about the very important role that medical colleges and universities are playing right now in this stressed out time?
Well, Steve, you're going to hear from the upcoming panels from the leaders of the academic medical centers, the role that academic medicine has played on the front lines with COVID. And that's not surprising, given academic medicine's missions of not only clinical care, but research, importantly. And Congresswoman Matsui talked about the role of research and what our academic medical schools are doing in terms of developing new tests, developing therapeutics, working on vaccines. And these results are educating the future healthcare professionals. And those professionals are critical as we move forward. And so the missions of those centers make them important anchor institutions in their community. And during this pandemic, not only have they cared for COVID patients, but they've also worked hand in hand with their public health departments and their community stakeholders, looking for surge capacity, looking for housing for homeless individuals who contract COVID, talking about those other issues. And David talked a little bit about healthcare disparities. Our members have been working closely with our communities in that space in terms of food insecurities, housing insecurities. We need more data to be able to understand exactly where those issues are so we can get to the goal of where Director Redfield mentioned. But I think what an important, a little bit of a silver lining that has come out of this COVID pandemic is the role of academic medicine, not within the pandemic, but with their communities. And one of the ideas that we have, as we talked about, is we need to start thinking about the next pandemic. We need to start thinking about how we are prepared and get out of this whack-a-mole mentality that we have, that we're dealing with. And one of the ideas that we've thought about is the idea of regional pandemic centers that would bring together the research and clinical and educational expertise of academic medical centers, working closely with their public health departments that are woefully underfunded and that need sufficient funding, working with community partners, and start thinking and planning about what's needed so that we're ready for the next pandemic. And when you have that type of collaboration, maybe it's not just the next pandemic, maybe it's just the next opportunity to improve health. And that's some of the things we're thinking about in the role of academic medicine.
Thank you for that. David, I'm going to throw you a curveball here a little bit.
Okay.
You know, Richard Edelman, Edelman Public Relations has something called the Edelman Trust Barometer, and I pay very close attention to it. And when you look across this over a period of time, you know, trust in institutions, trust in government, trust in companies, you know, it's all under stress. But trust and listening to those doctors and medical experts and scientists on his barometer is very, very high at this moment. But we also know that there's a significant part of the population that's skeptical. You know, science has almost become a bit political in a way. And I'm interested, you know, you're a man of culture, values, history, you know things. I'm just interested in what you would put on the table about helping to restore trust for those who are still on the doubting side of that, because that's got to be part of the equation of getting the nation into a less dysfunctional, healthier spot. So excuse the curveball, but tell us how to fix it.
Steve, curveballs are always fun, especially coming from you. Well, I'll just give you two quick thoughts. I know we have limited time. One is that the scientific method is really hard to get your head around if you're not a scientist. So you make an observation, then you come up with an idea, a hypothesis of what might explain that observation. And then you make more observations, and if the new observations, the data, don't agree with the hypothesis, well, you get rid of the hypothesis, you don't get rid of the data. And so that means that things change. For example, early on in the pandemic, when we were very, very short on personal protective equipment, we wanted to preserve masks, for example, mainly for those on the healthcare front lines. And then later it turned out, as the pandemic spread rapidly, that everyone needed to wear a mask, which is very, very important right to this day, right to this hour, right to this minute. And so it's very, very important to realize that as new observations are made in science, recommendations will change. But you can understand that if you're not very conversant with that method, then you might be skeptical. Well, why are these people flip-flopping and changing their minds? And whose fault is it? It's our own fault as scientists that we need to do a better job of sharing with the public some of these ways that science works. And then the second thing I would mention very quickly is that in communities that have been underserved by the current system, you can't blame them for being skeptical and having low trust in the current systems. And we need to listen to, not talk to, but listen to, Steve, people in those communities, communities of color, underserved communities, and work with them to use their own trusted messengers to find out what could we be doing better communication-wise, what could we be doing better service-wise. And by doing those two things, explaining the scientific method and working with members of community who are trusted messengers, those in the communities themselves, we can perhaps learn more to regain our own trust.
Well, David Skorton, CEO of the Association of American Medical Colleges, and Karen Fisher, Chief Public Policy Officer there as well. I really enjoyed this conversation. Thank you so much for helping our audience to get a bit of a dive into what's happening in this world. Thank you very much.
Steve, thanks for all you do today and every day. Keep doing it.
Thank you.